Namaste, I'm Dr. Lalitha, Vice President for Yashoda Hospitals. Most of us are turning COVID positive. A lot of asymptomatic youngsters are getting themselves tested, or if they're mildly symptomatic, they're getting themselves tested and they're all coming COVID positive. And then there is a lot of panic going around. There are no beds in the hospitals. What do we do? Should we go to a hospital right now? So a lot of questions are going around. So we would like to give some clarity as to what you need to do. Now, hospitalization is not required for everyone who is positive for the coronavirus. We have asymptomatic people and mildly symptomatic people who can take care of themselves or who can take care of the positive family members at home itself. We have two categories. One is the completely asymptomatic group, wherein you are tested COVID positive, probably because you had a contact with a person who is COVID positive, but you do not have any symptoms. So you can very well manage yourself at home. The second category is the people who are mildly symptomatic. Now, what do we mean by mildly symptomatic? Mild fever less than around 100.4, mild sore throat, mild headache, mild weakness. Now, COVID-19 has a variety of symptoms, but the most common ones which are now accepted are having sore throat, fever, cough, it could be dry cough, headaches. Now, headaches are also quite common, having loss of sense of smell, loss of sense of taste, and weakness. Weakness and fatigue again are very commonly associated with COVID-19, having a mild case of diarrhea. So these are the symptoms which are mild. Then you can stay at home and monitor yourself. Anything beyond this, or people with very high risk factors like extremes of age groups, people with severe heart disease, kidney problem, or some other comorbidities, or people who have difficulty in breathing, who have a state of confusion, must definitely be rushed to the hospitals. In order to assist COVID positive people to stay at home and monitor themselves from the safety of their homes, Yashoda Hospitals has introduced home quarantine or home isolation packages. In this package, you are given a pulse oximeter. So this is how a pulse oximeter is. The moment a package is taken, this kit will be sent to your home, and then you will be taught as to how to use this, what are the normal parameters. Along with the pulse oximeter, you will also be given a digital thermometer with which you can measure your temperature every day. It is better to do it twice a day, the pulse oximeter as well as the temperature. You will also be given a set of masks, and then you will also be given a set of gloves and a sanitizer bottle. And the most important thing is these guidelines. Now, these guidelines are put in very simple language, and they are taken from the guidelines given by the government of Telangana and our central government based on all the scientific knowledge that is available as regards coronavirus as of now. So this book is a must read. All of you at home must remove this book from the kit that you are given and read it. In the home isolation packages, we have a trained nurse who is specifically trained to care for people who are suffering from COVID-19. They will connect with you every day virtually on a video consultation, and they will monitor your vitals. They will ask you to look at your oxygen saturation and your pulse rate, and then let us know so that we will jot it down, and then we will know the daily progression of your oxygen saturations. We will also note down your temperature and any other symptoms that you are having, or if you're on any medication, those medication reconciliation also will be done. So other than our expert nurse practitioner connecting with you every day, our physician also will connect with you on alternate days or whenever you need them. We also have a dietitian who will tell you about the diet that is recommended, especially keeping the coronavirus pandemic in consideration. And then the most important also is a physiotherapist consultation. Now, they will be telling you about the breathing exercises, specifically designed to open up and aerate each and every part of your lung. And this book that we're also giving you contains all the breathing exercises that you need to do, for how long you need to do. And we also have a spirometer which is given to you in the kit. So this spirometer also helps you in breathing and kinds of sets a target as to how much deeply you must breathe in and how much deeply you must breathe out. If you are following the home isolation, the three most important things that you must do first is to isolate yourself. You be in a separate room. which has a window preferably, and you keep yourselves away from others. The three golden things to prevent either getting coronavirus infection or giving it to someone else is to maintain a safe distance. If you are further away from the patient, the viral load is very less, and even if a person gets exposed to a very less viral load, there is less a risk of him showing symptoms. So please isolate yourself at home, try to be in a separate room and keep away from the rest of your family members. Hand wash, hand wash and hand wash. Now there is no substitute for a good hand washing technique. Even if you touch a surface where the virus is there and the virus is on your hands, if you wash your hands properly, either with a hand rub or with a simple soap and water for more than 30 seconds in the recommended fashion, there is no way you will be spreading this virus to yourself or others. The virus will not enter through unbroken skin, through intact skin. So even if you touch an area which has the virus and you wash your hands off and you do not touch your eyes, nose or mouth, you are safe. The moment you do not wash your hands and touch your eyes, nose or mouth, the virus enters through the mucous membranes and then it enters into your body. So hand wash is most important. If you have to open the door for someone to give you food or for you to hand out your soiled utensils in a separate bag or something, that's okay. Wash your hands. Make sure that your hands are not contaminated. Open the door and then take whatever is needed and then close the door again. So hand wash is very important. And one more important thing is a mask. Please make sure you wear a mask because you will shed the virus when you cough, when you sneeze. So when you wear this mask, the viral load that you shed into the atmosphere is very less. So your family member who comes to serve you food or who comes to you in case you need something will not get exposed. So keep your distance from everybody in the family and wear a mask, and hand wash is most important. Now to the guidance to the person who is taking care of you, when they come in to give you food or to talk to you or to remove your utensils or your soiled clothes, etc., they also need to wear a mask. Spend as less time as possible with you and try not to touch anything, and even if they touch, that's okay. Immediately go and wash your hands. Your soiled utensils or your soiled linen also has to be kept separately in waste paper bags which are there as a part of our kit, and then they have to be washed. If you want to wash it yourself, that's very good. If you cannot wash it yourself, then the person who is taking care of the things that you have used should wear a mask and should wear gloves. These gloves are also available in the kit that we give you. For you and for the person who's taking care of you, physical distancing, less time in contact, washing your hands and wearing gloves are the most important things that you must not forget. Having difficulty in breathing. Now, most of the time there are panic attacks. The moment people know that they are COVID positive, they're suddenly going to panic and have breathing difficulty. There is nothing to panic. 80 to 90% of the people with coronavirus can take care of themselves at home without getting hospitalized. So just sit down, relax, take deep breaths, try to do those breathing exercises which are given in the book, and then measure your oxygen saturation again. If it definitely drops below 90, then you can approach a hospital. Or when this difficulty in breathing is worsening, or you have chest pain, a kind of a tightness in the chest, or you have uncontrollable diarrhea, high fever which is not coming down with paracetamol, or then there is confusion, you're not able to eat anything, or there is extreme cases of lethargy. In these kind of cases, or when you're turning blue, your peripheries are turning blue, that means oxygen levels in your blood are less. In this kind of a situation, rush to the nearest healthcare facility. Don't try to phone anyone. Don't go for any other advice from anyone. Just go to the nearest hospital in this situation. And then when do you stop home isolation? Now the government guidelines say that you can end your home isolation after 17 days of onset of your symptoms, or when you have a 10 days period of not having any fever. Usually in the light of the general knowledge, the common thing is that a person remains infective for around 2 days prior to showing symptoms till about 8 days after getting symptomatic. So that is the duration in which you are most infective. The home isolation or quarantine packages are available on the website. You can either book through the Yashoda Hospitals website or at any one of our hospitals located at Secunderabad, Somajiguda or Malapet. You can approach any one of our personnel who will help you with it. Three most important things, as I've already mentioned, as the whole world is telling us, the most important thing is a physical distancing. Keep distance. That is to protect yourself from getting the virus and to also prevent you from giving the virus to other people. Then wearing a mask. Again, the mask will definitely decrease the viral load and protect you as well as the person who is in front of you. Hand wash is again very, very, very vital. Never underestimate the importance of hand wash. You can simply wash off the virus from your hands.